Over the past 6 months and the duration prior, we have generated traction and success towards engaging with various partners in different aspects of the project to leverage resources, capacity, and know-how as a way of bringing health closer to the Rwandan community. Society for Family Health has had remarkable progress towards the betterment of the lives of Rwandans living in far-to-reach areas by making health services accessible. We are proud of what we've achieved in the different interventions we have made, including health system intervention through the construction of health posts, HIV prevention programs, malaria prevention intervention, cervical cancer screening and prevention program, adolescent sexual and reproductive health programs, and the newly launched project, the Blue Room.
The last 6 months have been very exciting time. Despite different challenges in the health landscape, we have seen tremendous progresses around partnerships with different donors. For example, we partnered with the Rector Foundation to screen 20,000 women, and we have partnerships with the Faro Hospitals, Kanombe Military Hospital, King Faisal, and University Teaching Hospital of Kigali. This is wonderful. In these 6 months, we are also able to partner with ARX, the affiliate of African Leadership University. We have been able to enroll a number of health posts and digitizing them to be able to gather data and use the data in the real time.
Access to healthcare is one of the biggest components of universal healthcare. Health posts have provided a great solution towards the challenge that faced hundreds of thousands of Rwandans. Before, community members walked long distances to access healthcare services crucial to them. This would result in more complications or even death, especially to expectant mothers and children. Now, health posts have been constructed in hard-to-reach areas to cater for the needs of the people, health-wise and financially.
Developing country like Rwanda, there are multiple needs, and of course the resources are limited, so government has to spread the resources to the various areas of need, which then requires that they enable full comprehensive health provisioning, particularly in the provision of primary health care facilities to our citizens, that the government enters into partnership with different actors, both health entrepreneurs, but also businesses that want to invest in health as an enterprise.
Nearly 90% of people seeking for care are treated at the community level. We have around 60,000 community health workers across Rwanda. But also the community health workers are supported by health posts.
And basically the purpose of establishing a health post is to bring down the services, to improve on universal health coverage, to reduce the distance people take to walk to the health center. When people suffer from complicated malaria, they die. But when they get services very close, so they come to seek health on time, and it prevents death and complications.
Twabonye ivuriro hano bitubera ibintu byiza cyane kubera ko twafata inzira tujya hariya mu Kibungo tujya kwivuza ugasanga biraturushye. Rero turashimira abantu abayobozi batutekerejeho kutuzanira hano ivuriro natwe tukivuriza hafi.
As we move towards universal health coverage and its intricacies, we realized that one of the biggest challenges we are likely to face in the long run is management of the information, data, and resources allocated towards the running of the health posts. As such, we came up with one-of-a-kind situational room meant to be centralized data center that functions as a base of flow of information and analysis for better management, data tracking, and resource distribution.
All that data comes in. It comes in here, and we are able to capture the information, display it in the Blue Lake dashboard, whereby you capture only the operations and finance and clinical.
With cervical cancer being one of the greatest challenges affecting women across Rwanda, SFH is working closely with the Elector to bring key services to health posts, including awareness, screening and treatment to the key populations, including expectant women and young girls. SFH has also championed the training of community health workers to leverage various channels such as door-to-door visits and community campaigns in order to support these vulnerable women and young girls.
2 minutes in the world, a woman dies from cervical cancer. So the idea of eliminating cervical cancer is early detection, early screening, and early treatment.
Didn't know the signs and symptoms of cervical cancer. But from the trainings of Electa Foundation's support I have attended, I started to work with cancer detection.
I managed to screen around 20,000 women in less than 4 months.
Bampamagara ubwa kabiri nagize ubwoba ko numvaga bayinsanzemo, ariko naragiye bayinsuzumye bambwira ko nta kibazo, ndongera ndatuza.
Malaria has been marked by CDC Rwanda as one of the leading causes of death in Rwanda for the past few years. In response to the situation, over the years, there are several programs that have been launched to support pregnant mothers and children under the age of 5. This year, SFH, in partnership with SC Johnson, launched a new product that will help combat the malaria challenge in Kamembe and Gihundwe, located in Rusizi district.
SFH yaraduhamagaye iraduhugura, imare kuduhugura nibwo yaduhaye izamverope twagiye kumanikira abaturage mu rwego rwo kwirukana umubu utera malaria. Abarwayi baragabanutse cyane, abarwayi bamaze kugabanuka cyane, nk'uko nabashaka kwakira abarwayi 45 mu kwezi kumwe, nakiriye abarwayi 10 bitewe n'uko za envelope zatangiye gukora umumaro w'icyagize gute cyatumye SFH iziza.
Ubundi nkimara kubona envelope yamibu yaragiye ntabwo nongeye kuyibona, amalaria ubwo nyine irwanya gutyo.
The project, furthermore, has seen the reduction of plastic waste across areas of intervention by distributing a total of 80 recycle bins and creating over 34 jobs to make the environment safer and better for the community. As per the CDC Rwanda, HIV ranks among Rwanda's top 10 causes of death and only second to malaria. CDC Rwanda funded the key population program targeting marginalized groups, men who have sex with other men, and female sex workers, improving their access to vital HIV prevention and treatment services.
Services za key populations ni urugendo tuba dufitemo aba female sex workers, tukagiramo aba males who do sex with males, MSM. Abo bose rero turabagira ngaha, baraza tukabakira, tukabigisha, tukabakorera HIV testing, ubaye positive tukamuvura, ubaye negative tukamukorera prevention, tukamwigisha uburyo ashobora kwirinda kugira ngo ya negativite ye afite uyu munsi nejo azabe akiyifite.
For those key populations that we are not able to reach with our testing services at the health facilities, we are able to take services outside the facility and do community outreaches, but also provide self-test kits that can be done in the confines of someone's home.
Furthermore, to involve youth in HIV prevention, SFH partnered with Annabelle and the Ministry of Youth to launch the Adolescent Sexual Reproductive Health ASRH program, promoting open discussions on sexual reproductive health.
So really the objective of the project implemented by SFH through the grant of Annabelle Barame is to reinforce the youth-friendly center, to deliver a health primary service, and to mobilize the youth for friendly services.
We are happy to partner with our partners, and we believe that the next 6 months is even going to be more exciting. Thank you very much.